There's over 150 types of headaches, which is classified from the Headache Society. These are branched into primary and secondary type headaches. So primary means that the headache is a direct cause of the lesion. So an example of this would be migraine, tension type headaches, cluster headaches. Secondary type headaches are a headache which is caused as a result of something else going on. So this could be a cervicalgenic headache, it could be a hormonal headache, which is menstrual, and it could be a vascular or an infection type headache. Today we're just going to talk about the three main types of headache that we see in the clinic here today. So we see a lot of cervicalgenic headaches, migraines with and without aura, tension type headaches. So the cervicalgenic headache seen in about 15 to 20% of the population, and so this headache is a secondary type headache and it's coming from your neck. So with the cervicalgenic headache, it comes from the upper three segments of your cervical spine, so C1, C2 and C3. So classically, if you've got a cervicalgenic headache, you're going to feel it unilateral, so on one side. Rarely is it both sides with the cervicalgenic headache, but if it is both sides, one side will be more dominating than the other. People classically will feel the cervicalgenic headache coming up and over the top of the head, and you can get it behind your eye. You can also get it to the side in the temporal region, and you can also get it on the top. So it all varies as to what segment is causing it. You can also get nausea and some vomiting, some visual disturbance with the cervicalgenic headache. Rarely would you get any sensitivity to light or sound. The headaches coming from the neck will last only a couple of hours, about 3 to 6 hours at most from your neck. Whereas the next type, the tension type headache, these ones last for 30 minutes but then can go straight through to 7 days, unfortunately. And as the tension type headache's name suggests, it's coming from tension and tightness through your head. So people will describe the tension type headache as a vice-like sensation which you'll feel bilateral, so on both sides, so it's not one side, and it goes over your eyes, at the back, and then through over your forehead as well. So it's that really tight feeling. That's a primary headache because the cause is a lot of the tension and tightness. So classically a lot of stress driven, which is why it can last for up to a week. The next type of headache is your migraine. So migraine is unilateral. So people will mainly get it on one side, they won't get it on both. And it's more of a moderate to sharp type of headache. With the migraine, you will get either nausea or vomiting, and then you will also get photophobia or phonophobia, so you'll get sensitivity to light or sensitivity to sound. And this is where people will want to try and go into a dark room or in a room where it's quiet, pretty quiet, because that's one of the symptoms trying to help. The migraine with aura, so aura is a sensory disturbance, and it's a neurological disturbance which is recoverable, so it's only short term. The most common symptom of aura in a migraine is your vision. So you're going to be seeing some visual disturbances. These people will describe perhaps some dots through their eyes, or even a bit of loss of vision. Other aura symptoms will be loss of speech. You can have sensory disturbances through one side of your body. And classically, when people are experiencing a migraine with aura, you get the aura about 30 minutes to 60 minutes before you actually get your headache. So a lot of these people can actually be feeling like they're having a stroke. And so what we do see in the clinic with the history is that these people have then had to go to a GP or to the hospital. They get thoroughly investigated for stroke-like symptoms, but it all comes back negative. And what we find is that it's a migraine with aura, and so the headache develops after. So they're the two types of migraine. When it comes to treatment, physios have really good success with treating headaches. The main one that we've got a lot of evidence for is your cervicalgenic headache. So like we were saying, it comes from the upper segments of your neck, and so physios who are trained in the area, we can mobilise, manipulate the upper cervical segments and get a really good change. So there's a really good body of evidence for cervicalgenic headaches. With the tension type and the migraine, we can actually also get some really good changes with headaches in these people, because there's actually a common spot in the brainstem which is feedback from the trigeminal nerves, which give you all the facial type feedback, and also your cervical segments coming up, and it's this trigeminal nucleus, trigeminal cervical nucleus, which is a common point, and so we can actually access that point through the upper cervical spine to change some of your migraine and your tension type symptoms.